wrong, even after having 6 years of education, more than 3 years of experience regarding medications, the public or patients are still not confident to take guidance or advice from pharmacists. Now, you are not able to work in a country which has provided you this course. You're not paid enough. You're not there to even improve the status there, because pharmacists work long hours. But does the pay match the effort? So the work is really, really demanding, but pay for that effort is really less. Okay. This is faced in many countries. Basically, if you're planning to migrate, you have to consider so many factors other than the salary package, whether it is enough to meet your needs, meet your cost of living. If you're having any debts or loans, whether you will be able to repay them with this amount. If taxes are there, after that, how much you can save. So many factors has to be considered even before you're migrating. And this is one of the reason, one of the disadvantage now we are facing. With more pharmacists than available positions, job hunting is a struggle. So here we are talking about the progression or career growth. So if you're a clinical pharmacist, the maximum you can achieve is being a head of department or taking an administrative role or becoming a chief pharmacist. There is not much progression unless you have taken any additional certifications, or you have taken some other alternative path, or you're planning to contribute to something else like clinical research. Complex certification process, migration difficulties, and the financial burden slow career transitions. Registration examinations, the payment for document evaluation, migration hurdles, all this process makes it a little bit challenging to migrate to other countries. It's not that easy, as many of them who have migrated, they know what all struggles are there. So it's not that much easy. This is one of the disadvantage. High pressure environments with demanding hours in clinical and retail pharmacy settings. Despite their expertise, pharmacists often go unrecognized in the broader healthcare system. Now, I would like to give you a story here. It's my personal experience. One of the patient, I provided a patient counseling on use of particular medication, and still that person couldn't accept it because they are still thinking that we are someone who is just taking a medication, explaining them as per doctor's advice. That's it. Whatever other explanation we are giving about the medication, they're thinking it's there in the prescription. Like, they're thinking we're just blindly following what has doctor prescribed, and we are just selling it to them. That's what the perception is. And he wanted me to confirm with the treating doctor whether what I said is right or wrong. And of course, I really don't want to waste my time on this. By calling the doctor, already the entire process of coming and taking the medication in pharmacy is a huge process. It takes a lot of time. And on top of that, I want to confirm whether what patient counseling I provided was right or wrong. Even after having 6 years of education, more than 3 years of experience regarding medications, the public or patients are still not confident to take guidance or advice from pharmacists. Now, what picture does this give you regarding the perception of pharmacists and the society? If you're any pharmacist who is having, if you really want to do something in social media other than entertainment, if you're interested in education, please do give some educational post, write an educational post, or do a video in your YouTube channel or any platform. Educate, give public awareness to give awareness to the society or public that pharmacists are not just dispensers or someone who is selling medications like cosmetics or perfumes or something. They are somebody who are having that knowledge and expertise to provide a patient counseling and who know the proper use of a medication. Now, this is a problem where we are facing. This is something which I faced in an international country. So, I don't want to even say what is the real picture in India, but it's okay. Not everyone thinks like this. I'm sure majority of them value pharmacists, but there are still many people who are not trusting pharmacists that much. So even after putting your 6 years in this course and you are not able to work in a country which has provided you this course, you're not paid enough, you're not there to even improve the status there because you want a better life, you will be moving to abroad countries. This is going to happen again and again unless and until the PCI, the governing bodies, still doesn't give the opportunity, are not still opening their eyes. This is going to be happening again and again. And there are so many organizations still working hard. They're staying in India, they're working hard so that PharmD gets recognized and clinical pharmacist role gets recognized. And also there are so many board certified pharmacists still working in India, trying to improve the healthcare system in India. But still, if the payment is less, if there are no much opportunities, there are not much career growth, nobody is going to stay there. Everyone is going to move out and they will be working for other countries. Nothing will be improved here. So this is what is happening in reality. So if any pharmacist who is interested to do vlogging, if you want to contribute, you want to provide value to this society, please produce videos regarding medication, counseling, even in your own language. So whenever people are scrolling their phone, if they find a video regarding a medication information, and you're addressing yourself as a pharmacist, they will know, okay, a pharmacist knows about this medication. They are someone who has to be respected. They know things. Whenever you're having a chance, you can pause the video and just read whatever is in there, because I don't want to go through everything. Now, what does this really mean? So here you can see a global recognition and roles of pharmacists at 2024 data. You can see the recognition level between different countries and what are the factors influencing this recognition and what is the role, pharmacist role in healthcare. Now, this particular data is based on various healthcare systems, public perception, and pharmacist role in patient care. I'm just summarizing it. So countries with highest recognition level for pharmacists is Germany, Switzerland, Canada, Australia, UK, Ireland, and Scandinavian countries. Coming to the moderate recognition is US, New Zealand, UAE. Low recognition levels would be India, Philippines, Egypt, Pakistan, and even some various African countries. This is there. Coming to India, what happens is often still now the public is perceiving pharmacists as dispensers and they're not considering them as a healthcare professional. Now, clinical pharmacy is developing, but pharmacists lack prescribing rights and are often overshadowed by physicians. So all these are based on the 2020-24 reports. So these are the downsides. It's not only for clinical pharmacists, even for pharmacists, these are some disadvantages or downsides for this course. If you had invested your 6 years and there are so many disadvantages going around. But now let's come to something positive here. Now, what would you choose, or what would I choose as my alternative career path? So if now I'm in pharmacy and I'm having an option to choose so many things alternatively, because I have done so many videos regarding alternative career paths which you can choose as a pharmacist. So if you're somebody who's interested in technology and healthcare, now AI software is booming. AI is a booming industry. Now it is also used in drug discoveries. So if you're really interested in that, you can do something in that field: health informatics, clinical research, functional medicine, pharmacy marketing. Pharma marketing is a huge industry. So all these are kind of alternative opportunities where you can go for better career growth and higher salaries. So always remember, your 6 years, your skills as a pharmacist are valuable. You are valuable. The only thing here is you just need to apply them differently. My advice for future PharmD students or somebody who really wanted to pursue this course, first thing, you should need that real passion for clinical pharmacy, because only if you're genuinely passionate, you will think this as your responsibility to be a better clinical pharmacist, your responsibility to improve patient care. All this comes up if you're having that real passion. And if you really feel that you genuinely need to do something in the healthcare field, that passion should be there. So this only allows you to work directly with patients, helping optimize medication therapy and making a difference in healthcare. And just don't pursue a PharmD course just because you want to go abroad and there are so many opportunities. Please don't do this. Even many countries like Australia, basic bachelor's degree in pharmacy is enough. If you want to do anything in master's or if you want to migrate, a bachelor is more than enough. And for that, just don't waste your 6 years. Now, if you have already started and you are pursuing PharmD, make the most of your PharmD course. First thing, master the basics. Build a strong foundation in pharmacology, pharmacotherapeutics, pharmacokinetics, pathophysiology, and clinical guidelines. Don't just study all this. Don't just mug up all this for examination. Go for the exams. When you receive a question, you just answer it perfectly with all the points. You score high marks, finish. You go back to your home after 2-3 months when some treatment is asked regarding a disease or something. Finish. You don't know anything regarding this. So you will have to find a way to learn this in a different way that it remains in your long-term memory. You have to be updated regarding everything. You should really be strong on your basics. So the basics is, as I said, pharmacology, therapeutics, clinical pharmacy, clinical guidelines. You should know about doses, drugs, treatment. All these are very important. Next thing is to stay updated. So if you are in PharmD, you have signed the long-term contract of lifelong learning. Congratulations. So you will have to learn every day, stay updated, regularly review treatment guidelines, dosing recommendations, and even disease management strategies. Then get hands-on experience. Whatever college you're choosing, if you're somebody who is going to start, whatever college you're choosing, make sure they're having the best hospital. There are so many patients visiting. Only then you will learn, get that experience. So participate in ward rounds, actively engage in case discussions, ask questions to doctors and senior pharmacists. Please ask questions. If you're having a doubt, ask questions, especially to doctors, because the answers they're going to give you will blow off your mind if they're a good treating physician, because they will be answering you in a diagnostic experience, like they will be explaining you that concept based on their experience, and they will also help you to understand it very well as per diagnosis. They can correlate and give you that answer. So ask questions. And even if you're working in a hospital where you are not even allowed to do ward rounds with doctors, I don't know what course you're learning. So please ask your teachers or professors to involve you in ward rounds along with doctors. So something you really have to do. A clinical pharmacist who doesn't go for a ward round, who doesn't know what is happening, who doesn't know how a medication is prescribed or how patients are being diagnosed, I don't know what course you're taking. So basically, go for, if you're having such difficulties, you're facing such challenges, please contact whoever is responsible to provide you this experience of participating in ward rounds at least. Okay. Next, involve in real patient interactions. Observe and counsel patients, understand medication-related problems, and contribute to therapy optimization. And next, research and case studies. Engage in case presentations, clinical research, and evidence-based practices to sharpen your decision-making skills. So if you want to take a treatment decision, you really need to experience case studies, focus, learn case studies, present them very well. You have to focus all these areas. Okay. Now, building a strong career path. So now regarding job opportunities, don't feel overwhelmed with all this information. My channel is all about inspiring pharmacists and especially PharmD graduates. So networking is one important tool here. Connect with experienced pharmacists, find good mentors, attend conferences, join pharmacy associations for mentorship and even career growth. If you're able to contribute something very small, it will make a great impact. So please, if you're someone who's interested to contribute to pharmacy field, join organizations, contribute. At least in your social media page, you can contribute something. As a pharmacist, you can contribute something from your side, which will be helpful to the public. And if you are so much interested in clinical pharmacy, you can consider additional certifications, challenge yourself, make yourself stand out among other clinical pharmacists. So you can go for board certifications or also even enhance your expertise in specialized areas like oncology, etc. Then try to improve your soft skills, especially communication skills. You can improve them, improve your confidence level, improve your teamwork, leadership skills, and try to excel in something like patient counseling or interdisciplinary collaboration or clinical research. Try to improve your skills in particular area so that nobody can replace you in that particular area. So 2025 is all about owning your skills. It's about being the best in what you do. See, you can be a person who knows everything, but if you're a person who knows one particular area so well, you will be valued there. So basically, try, if you're not able to do everything, all the things properly, at least try to master a skill and learn something about technology. At least a pharmacist should know how to use some Microsoft suite properly and learn about pharmacy. If you're so much interested in IT, you can learn about informatics, especially pharmacy informatics, digital health tools, and emerging trends in medication management and how AI is being used. All these areas are open to you. You can learn them. You can actually explore. Playlist link is available below the description, which you can check out. There are so many alternative options where you can further explore, or if you want to change your current role. And I understand the entire video might made you feel a little bit overwhelmed, but remember, you're not alone in this journey. There are so many of us already in this journey, have completed this journey and still working hard to improve ourselves. So you also have to do is you have to work hard, stay dedicated, and grab every opportunity that you see pass by your way. Just grab them. As a pharmacist, as long as you're willing to put an effort, you will be amazed at what you can offer and how much you can achieve. I hope this video was interesting to one and all. Please share this video if you found this relatable, or if this is going to help somebody in your community. You can share this video. Thanks for watching. Have a nice day ahead.